Hello and welcome everyone. Thank you so much for joining us today for our webinar on improving efficiency in radiology and mammography. My name is Elisa Mutsi and our CEO and co-founder Maja Magnusson is here with us today as well. Hi Maja.
Hello.
First, let's have a look at today's agenda. We will start with a brief introduction about Care to Translate, followed by a short demo of our app. We will then look at customer cases to see how customers use the app in mammography and radiology today. And we will take questions at the end. You can write them in our chat, or alternatively, you can also unmute yourself at the end and ask questions if you like to do that instead of using the chat. And now it is time for Maja to tell us more about Care to Translate and how the tool can be used in radiology and mammography.
Thank you so much, Elisa, and welcome everybody. Care to Translate is a digital translator that operates upon a medical library that can be used by healthcare professionals and patients. Our medical library is a vast collection of phrases with translations in 45 languages. And you can use those anytime you want to on your mobile devices, on tablets, and also in the web app on your desktop. All the content has been verified by native speakers with medical expertise. And hence, all the translations are at your fingertips 24/7, and we even offer offline support. And the best, it does not store any patient data. So implementing this service in your clinic is very smooth. Care to Translate can be used throughout the patient journey, and here are some examples. For example, you can use it to register the patient, to ask for their ID, for example, and also to prepare the patient by asking them important patient safety questions. You can talk to them during the examination and, for example, instruct them on how to position themselves. And of course, use the app to calm the patient throughout the entire stay. And after the examination, you can also use the app to give information before discharge, such as when will the results be available, should they book a next appointment, and when. The app can be customized to your specific needs and different departments. You can use our ready-made templates and get started within 5 minutes. But of course, you can also edit all the templates based on your unique needs, on your unique patient journey, and maybe your unique needs as a radiology nurse, for example. Once you have built all your templates and your account, you can share these with your entire department. And that is really, really handy to ensure consistent communication throughout the entire department. So no matter if your patient speaks German or Ukraine, they will get the same information as everybody else. Here are some practical examples when and how to use Care to Translate. For example, within mammography, it's really handy to use when you do your screenings. And here you can make use of it to give instructions to the patient to make sure that the patient understands how to position themselves, but also that it's really important to hold still to get good images. You can use the app to ask patient safety questions before a radiology examination, for example, and for instance, to ask if they have been given contrast fluid before and how they have reacted to it. And you could use it after the X-ray to give the patient the information that we are done now. I'm gonna get help from my colleagues to analyze the images, or also to inform that it's really important to remain in the waiting room if you have been given contrast fluid. And of course, you can use it also to increase comfort and reduce stress by informing the patient what is going to happen next, and so on. But to give you an even better example, let's hear again from Elisa, who will give you a demo of our app.
Thank you so much, Maya. And if anyone has any questions for Maya on any topics that she covered, please make sure to add them to the chat and we will be soon able to answer them. So this is our app, Care to Translate, and this is an account created for a radiology department. You can see the blue icons on the screen, and these are playlists, which are like different steps or different situations within the patient journey, where you need to inform the patient, instruct the patient, or ask questions. I have selected Italian as the patient language, as that is my native language, and I will now go into one of these playlists, for example, the CT examination playlist. And you can see that there is a set of phrases structured in a certain order, which of course can be revised and changed. And to translate, you can simply press on a phrase.
Sta per essere visitata utilizzando questo metodo.
And the phrase is translated via audio and text formats. So you can let the patient know you're going to be examined using this method, CT.
Tomografia computerizzata, TC.
You can instruct the patient to take off these items.
Tolga questi oggetti.
For example, any metal objects that you are wearing.
Qualsiasi oggetto metallico che indossa.
And you might have noticed that some of our phrases display a small image icon. This is image support, which can be used to convey the meaning of the phrase further. So for example, with this phrase, if you want to support what you are saying, you can use an image to show the patient. You can also let the patient know we will put a radiation protective garment on you.
Le metteremo un indumento protettivo contro le radiazioni.
And again, you can show an image to support what you're trying to say. Now you can ask questions as well.
Le è mai stato somministrato un mezzo di contrasto prima d'ora?
For example, have you been given contrast fluid before? And you can see that when you're asking a question, there are built-in answers within the app. So you can either instruct the patient to please nod for yes and shake your head for no. Alternatively, the patient can press on one of the built-in answers. For example, yes.
Yes.
And in this case, the audio recording plays in the healthcare staff language. Now, if you want to search for a phrase that is not currently in the playlist, you can of course search the entire library. So you can, for example, type a keyword or phrase, for example, contrast fluid, and again, you can see all of the phrases related to contrast fluid, and you can choose one and translate.
Il mezzo di contrasto rende le immagini più chiare.
And you can translate from the search function as well. Now you can, of course, change the language, the patient language at any point. So for example, you click on the language icon and you can either scroll down and choose a language, or you can type. I will choose German. And if it's a gendered language, like German is, you will be prompted to select whether the patient is addressed as male or female. And now you can ask the same question.
Haben Sie schon einmal Kontrastmittel verabreicht bekommen?
In the new patient language. You can also see that we have content on breathing instructions, for example, as we know that that's very important within imaging. And for example, you can let the patient know, breathe in and hold your breath.
Atmen Sie ein und halten Sie die Luft an.
Or breathe slowly.
Atmen Sie langsam.
I will now switch to our account for mammography. So this is an account created for a mammography department. And I will show you the mammography examination playlist. So you click on the playlist, and again, you can see a set of phrases structured in a certain order, and you can let the patient know you're going to be examined using this method.
Sie werden mittels folgender Methode untersucht.
Mammography.
Mammographie.
You can let the patient know what is going to happen. So, for example, the breast will be squeezed flat during the examination.
Während der Untersuchung wird Ihre Brust flach zusammengedrückt.
And you can show the image to further convey what you are trying to communicate, to make it clearer for the patient to understand. Now we also have content on positioning, so you can instruct the patient on how to position themselves. For example, please stand with your chest against the plate.
Bitte stellen Sie sich mit Ihrer Brust gegen die Röntgenplatte.
Or lift your arm and keep it there.
Heben Sie den Arm und halten Sie ihn in der Luft.
And you can let them know that they need to hold completely still.
Nicht bewegen.
Now, when the examination is finished, you can let the patient know that the examination is finished now.
Die Untersuchung ist jetzt beendet.
And you can get dressed again.
Nun können Sie sich wieder ankleiden.
And you can wish them a nice day.
Ich wünsche Ihnen einen schönen Tag.
So that was a short demo of our app. And I will now share our slides again. Just a moment, please. And again, if you have any questions on the app or any of the topics that we've covered so far, please write them in the chat and we will be able to answer them soon.
Thank you so much, Elisa. This was a great demo, and hopefully you understand now how easy it is to administer the app. And we have about 600 clinics today, or even more, that are using our app in 11 different countries. And I wanted to give you 2 examples from customers using our app in mammography and in radiology. So on the next slide, you will see that Karolinska University Hospital is using our app today in their mammography clinic. And the department at Karolinska University Hospital calls around 60,000 women for screenings each year. And the problem was that only clinical patients have the right to an interpreter. And since the screening is considered a preventative measure, patients coming in from mammogram don't have the same access to interpreters. So the mammography clinic gets a lot of patients coming who don't speak the same language as their staff, and they needed an easy support to bridge these language barriers. And having used Care to Translate for quite some time now, they feel that it's a cost-effective alternative to interpreters, and it helps them to translate a variety of the phrases that they want to use, saving both time and costs. And one thing that they're also highlighting, it's helping them to instruct the patient to position themselves correctly, which also helps improve the quality of the images. So that has been a great use at the Karolinska department. And the other example I wanted to show you is the example of Mälarsjukhuset, the radiology clinic here. And the radiology department at Mälarsjukhuset has had great success with the app as well. Mälarsjukhuset in Eskilstuna, with 22 clinics, is the largest hospital in Södermanland County and is run by the region Sörmland. And here, the radiology clinic struggled with unexpected translation needs, and that led to delays in patient scans. And with Care to Translate, staff can now efficiently address these urgent translation requirements for safety questions, for example, before MRIs, and enabling them to conduct scans without having to reschedule, since a lot of the patients they had scheduled for exams showed up without information for the staff or the department that they actually needed to schedule for an interpreter as well. And just like Karolinska University Hospital, Mälarsjukhuset has implemented the Care to Translate app both in the mammography and radiology department. And staff members and patients are very satisfied. So that makes us really happy to hear, of course. And if you also think that you could bridge your language barriers in your department to effectively also give better care by effective communication during stressful situations or unplanned situations, increase the comfort for your patients when they understand and feel understood, and also enable maximum efficiency by maintaining direct and accurate communication, then we think this tool would be useful for you as well.
Thank you so much, Maya. And now I would like to open it up for our audience to ask questions. So if there are any questions, please write them in the chat, or you can raise your hand and unmute yourself to ask questions. So I see that there are a couple of questions in our chat. How do we manage with interpretation if a patient becomes acutely unwell during or after the IV injection during a CT or MR scan or in an emergency situation? If Maya, would you like to take that question, please?
Yes, of course. So you can, of course, set up playlists for these kind of events. So you can ask the patient about their well-being and about their feeling to identify what has gone wrong. But also here we have the option to add on your interpretation services in the app. So you can actually add a link to your, for example, phone interpreters to be able to call them directly if you would need to have a more open conversation with the patient in this case. So there are two options: prepare to be able to ask the patient about their symptoms, but also the link to the interpretation services.
Perfect. Thank you so much. And I see that there are more questions. Can the digital translator be adapted to individual departments and trusts?
Yes, very good question. So yes, of course. The templates we have in our platform are based on the current customers we have and the knowledge we have about how they like to set up their accounts. But once you have implemented these templates, you can adjust them as you want to. So you can rearrange the order of phrases, you can add phrases or take out phrases from lists. You can even add your own list from scratch. So you can basically adapt it to your very, very specific and customized needs. And that is what makes it really useful in various situations and various departments. And also, just to add on to what Elisa showed you, as you could see, you could actually have one account for your radiology department. You can add another account for your mammography department. And if you would be an entire hospital or trust, you could have several organizations and several departments. One example of such a customer is a large region in Norway. They have different hospitals using our tool, and each hospital has up to 100 or more departments in their account. So the staff can switch and go directly to the department they work in and use the customized account that is really tailored for the specific department. So it can also be used outside of radiology and mammography, of course.
Nice. Thank you so much. And we have another question. If I can't find the phrase I'm looking for, can I add the phrase to the app?
Yes, also a really good question. And the answer is yes. First of all, usually if you can't find the phrase, you can first of all reach out to us and we can check our library, because sometimes the phrase exists but might have a different formulation. So we can assist you in checking if the phrase exists. If it doesn't exist, you can order it, which means that we will translate it and implement it in all the languages that we provide on our platform. So there are two ways you can implement the phrase that you need.
Thank you so much. Are there any other questions? Please raise your hand or write them in the chat. You can also unmute yourself if you would like to ask verbally.
Probably no questions at the moment. But I know usually when I speak to mammography or radiology departments, I know that internet can be really shaky, and that can happen, of course, also in other departments and hospitals. So one question is, what do we do if our internet connection does not work well? And herefore we have added the option to use our solution offline. So what you do is if you use the app on your tablet or phone, you can choose what content you want to make available offline. So it's basically downloaded to your device. And then you can use your department's account even if you don't have good internet connection. And we know, especially in this area, it's usually even more harder usually to have good and stable internet connection. So that's an appreciated function we have for the app as well. And Elisa, are there any more questions?
I can see, I cannot see more questions coming in at the moment, so we can move on for now.
Yes, so as I said, if you agree that you need to bridge language barriers and this might be a good solution for you, then please just talk to your organization, your teammates, contact us for a trial. We're really happy to do a presentation for your department as well. So just reach out to us, and also mentioning if you're the first two departments to reach out to us, we will also provide you with a completely free trial for 2 months. So don't miss out on that. And if you do not work in the mammography or radiology department, but you work within the area of mammography or radiology, so maybe you might have customers or partners that work as clinicians, then please reach out to us to see how we could partner to help your clients and your customers overcome language barriers. Yes,
Amazing.
and I think that was all from us today. We're done a bit early, and I think that's great, so everybody can enjoy their lunch a bit longer. Thank you so much for listening in. Please send us an email or give us a call if you want to learn more, or if you think you should start trialing this app. It can really save time. It can enhance the patient experience and patient safety. So please reach out to us. You have our contact details here. And if you're curious, you can also download the app for free and have a look for yourself before you get in touch with us. Thank you so much, and wishing you a great afternoon.
Yes, thank you very much, everyone. Thank you for joining us today, and we hope to be hearing from you soon. Have a lovely rest of your day. Thank you.